Choosing a medical aid can be quite daunting and intimidating. There are so many options out there, and the information about each one and its different plans can be quite overwhelming. One of the big considerations is the Medical Savings Account, or MSA. Today on Health Matters, we look at all you need to know about MSAs.
So a medical savings account is basically a portion of your contribution that you pay to your medical scheme every month that is put aside in a separate account, and it differs from scheme to scheme in terms of what portion it is. But what is beneficial about the medical savings account is that it's yours to use for your day-to-day expenses, like paying for medicines or paying for consultations.
The money in your MSA can be used to pay for most medical needs, such as doctor's visits and prescription medication.
If you have a chronic condition, speak to your doctor, ask them to assist you to register on the chronic program, because what that does is it activates the chronic benefits for that condition. So instead of you using your day-to-day benefits, you use your chronic benefits. There's a whole basket of care that is catered for your condition. The other thing is always choose a generic. A generic is basically an equivalent of the original drug. It has the same safety, efficacy, strength. It's just cheaper.
It's extremely important to understand what your medical savings account won't cover, because a huge unexpected bill is the last thing you want to have to deal with during a medical emergency.
A lot of the time we fall into the trap of choosing what is affordable for us instead of looking into the finer details in terms of, I'm choosing scheme A or medical scheme A, and I'm gonna go with the first option because it's the most affordable. But maybe that option does not speak to your needs. So it's very important to understand the option that you choose. You understand the rules of your medical aid.
The term co-payment is also difficult for many people to understand. If you're paying thousands every month for your medical aid, why the need for a co-payment?
The medical aid may pay a portion, and then you will then have to pay a co-pay. Another example is if you go for a consultation to a specialist or a GP, for example, and that specialist or GP is not contracted to your medical aid, what you may have to do is pay a co-pay, because they will only pay your doctor a certain rate and you have to cover the rest.
Yep, in the beginning, your MSA does sound like a lot of money, but you will be unpleasantly surprised at how quickly that money runs out.
The other benefit of medical savings account is that whatever you don't use for the year is carried over to the next year, unlike your normal medical aid benefits that would just start from scratch from the start of a new benefit year.
It's also handy to know that any payments made into your MSA are tax deductible. It would certainly help to know how to manage your medical savings account so you get the maximum benefit from it and don't end up owing your medical aid.
Firstly, access care at the right level. Your GP should be your first point of contact whenever you need medical attention. Go to your GP, use one GP, because that GP has your whole medical history, instead of using multiple GPs for various things. Use the one GP and make sure that that GP is the person that really coordinates the care that you need. So if you need to be sent to a specialist, then the GP will refer you to a specialist. But if you don't, the GP will be able to treat you. So when you choose any provider that you want to go to the website, make sure that you go to a contracted healthcare professional, be it a GP, dentist, specialist, whatever. And you can easily find that you go to your medical aid's website and it will tell you. Then you don't have to incur co-payments.
So remember, your medical savings account is basically an accumulation of your money to pay for medical expenses. You must do your homework on whether a particular medical savings account is the right option for you and your dependents, or you could find yourself in a very nasty, expensive situation later on in the year.